Welcome, everyone. My name is Haley Yeager. I host the Truth and Fertility podcast. And before we get started with this interview, I want to share some exciting news that if you are watching this, and yes, I said watching, you will see that you can see my face. We are now on YouTube. I've been posting the podcast recordings on YouTube, but just with the regular thumbnail. Now you can see me and the person I'm interviewing. We have full video recording of every podcast episode. So head over to YouTube, to Truth and Fertility, subscribe to my channel, and you'll be able to see every single next interview that is coming up. You'll see the background behind me is still a work in progress, so it'll be slowly changing over time, but this has been a long time coming, and I'm really excited to finally have this option available for you. I'll have the link in the show notes below for the YouTube channel. I hope you enjoy the upcoming interview.
We're not just focused on fertility, we're focused on that health piece. And so what I'm doing through those pathways is first getting that clarity piece and figuring out someone's PCOS type and looking through their labs from an optimal fertility perspective, not just a survival perspective, because there is a difference. And most reference ranges for labs fall under the survival perspective. Okay, great. We're not looking for survival here. We're looking for optimum. We're looking for vibrancy. We're looking for health. It's ready for a whole new human to grow.
Welcome to the Truth and Fertility podcast. I'm Haley Yeager, and today I'm sitting down with Dr. Angela Potter. She is an integrative fertility doctor, nutritionist, and leading expert in PCOS. She is the creator of the PCOS Fertility Protocol, which is a proven protocol which helps women with an individualized approach to get regular periods, consistent ovulation, and best chance at getting pregnant. She's also a speaker and has shared the stage with various CEOs and global thought leaders from corporations like Google, Microsoft, and Headspace. She has also been featured on ABC, CBS, and NBC. What a woman. Welcome, Dr. Potter. I'm so honored to have you on the show.
Thank you so much. I'm thrilled to be here with you today.
Thanks. Yeah. Okay. So I know I just read your bio, but why don't you give a little introduction to yourself? So tell us a little bit about you, your family, and what led you to be the leading expert in PCOS?
Yes. Well, my family and I have got 2 kids, and I have been a PCOS fertility expert for quite a while now. And how that happened is that I was working I'm trained as a doctor, as a nutritionist, and also as a midwife. And so I did a lot of the general women's hormonal spectrum. I was doing postpartum work. I've worked with women through menopause. And then women were starting to come to see me, and they had PCOS, and they were telling me things like, I just was at my other doctor, and they were telling me that I can only try another round of medications. If that doesn't work, I can only move forward to IVF, and just doesn't feel right. Is there anything else I can do? And I'm like, yes, of course. And so we started working, and lo and behold, these women are starting to see regular periods, they're getting positive ovulation, and getting pregnant naturally. And so that's just what led me to really focus in on that, because I realized that with PCOS in particular, there's many other conditions that are similar to PCOS in this way, that women with PCOS are being dropped by standard medical care. There's so much of these treatment plans of, here, just take this medication, this is the only thing that will work. Or you've got PCOS and sorry, it's just going to be really hard to get pregnant and you're going to have to go straight to IVF. Just this really dismissive, like, we don't really know what to do for you, so sorry, kind of information. And these women are feeling it in their bodies, and they're starting to feel like, not just starting to feel like, but they're feeling deeply that their bodies are broken, that it's their own fault that they aren't pregnant yet. And that's just simply not true. It's more about biological safety, because PCOS it's a protective mechanism, and setting up these women's physiology, their structure internally, to protect them because their body doesn't feel safe for a pregnancy. And so what I do is help guide them to biological safety when their bodies give that green light and say, oh yeah, I'm ready to go.
Okay. Oh, I have never heard PCOS described as a protective mechanism. So I want to get into that a little bit too, because you're right. Like your body just is not ready for pregnancy usually, which is why so many women with PCOS have difficulty getting pregnant. And for those listeners that are new here, I also have PCOS. I have a whole journey of healing my PCOS, and it's kind of an ongoing journey, and different things have come up and year by year, but recognizing that there's not just one pill that's going to fix it, or if that pill doesn't fix it, then you don't have any other option. So I'm so grateful for the work that you're doing to help women, give them that other option. Before we go any further though, can you define PCOS? Like, what is PCOS? I've heard there's different kinds of PCOS. So can you kind of get into that and educate us on what that even is?
Yeah, absolutely. So PCOS stands for polycystic ovarian syndrome. And it's a bit of a misnomer, the name, honestly, because you think, oh, I must have cysts on my ovaries to have PCOS, polycystic. You don't. So the diagnosis of PCOS, there's 3 different pillars, and cysts on the ovaries is one pillar. Having elevated androgen hormones, which testosterone is the most well-known androgen hormone that leads to symptoms like chin hair growth, holding on to extra weight, particularly in the belly area. So that's another diagnostic pillar. And then the third is having ovulation issues. So this could be someone having low progesterone, someone not ovulating. Typical signs would be someone who has a very irregular cycle, or someone who hasn't had a cycle at all in the last 1, 2, 3 years. And so as doctors, when we have the person in front of us doing the diagnosis, we want to figure out, do they fall into 2 out of 3 of those diagnostic pillars? And if they do, then they have PCOS. And when you're talking about the types of PCOS, you've
Right.
heard that there are different types. So there are 4 types. That's the next step once you've got the diagnosis of PCOS. The types of PCOS don't have to do with the diagnosis, okay? So
Got it.
figuring out your PCOS type, and you could be one type or you could have all 4 types. It doesn't really matter how many you fall into. It's the fact that you figure out which type you are, because that is the next step of getting clear on what protective mechanisms your body is setting up that's keeping you from getting pregnant. So let me explain that a little bit.
Yeah.
Because earlier when I said, okay, PCOS is a protective mechanism, keeping someone from getting pregnant, it's not that PCOS happens to protect the person. What's happening is that there's different environmental triggers, genetics, a variety of things that can lead someone to have PCOS. The reason that somebody with PCOS is having a hard time getting pregnant is because then the body is recognizing these different issues going on inside the body, like elevated insulin levels, adrenal stress, inflammation from, say, elevated thyroid antibodies. There's multiple reasons that the body would be signaling, okay, I need to move into protective mode because this person's body is not ready to get pregnant. And so those are the types that we've got to identify. Okay, does this person have a lot of adrenal stress? What is their insulin picture? Have they been on hormonal birth control before? What is the inflammatory pathways? Are those really flaring in this person's body? And how is that then setting up this protective layer to say, I'm going to keep that their body is saying, I'm going to keep this person in a biological winter. That's what I call it. And so my job with my clients is to move them, is to identify first, okay, what are these different aspects that are keeping them in protective mode in biological winter? And then that leads the path forward to biological spring. Okay, when those inflammatory markers are down, when the cellular clearance in the body is working once again after being on hormonal birth control. And that's when we get that person to a point where her body is saying, yes, green light, full steam ahead, we're ready for pregnancy. And guess what? Not just pregnancy, the body feels healthy again. There's so many symptoms that come along with PCOS. And, she's feeling good in her body, feeling like her body is working as it's supposed to, and seeing, more energy, better sleep, clearer skin, all of these, which are all signals showing us that the body has moved into this green light biological spring.
Yeah, absolutely. And it makes me think too, even where you said, yeah, this is all, so many women with PCOS especially are struggling to get pregnant, and, because their ovulation shuts down or whatnot. But it really is too, just for overall, because we want our body to be as healthy as possible for just the sake of health. And so leading down the road, when we do want that pregnancy, we can get it, right? And that was actually my own story too. When I was 18, that's when I was diagnosed with PCOS. I was not married. I was not planning on having kids anytime soon. And it was just for the sake of making sure my body was healthy. And it was honestly a gift to my future marriage and to my husband, because had I not done that at so young as a single person, we would have struggled. I'm just kind of assuming we would have struggled probably later down the road. So yeah, it just for the sake of even making sure your body is healthy and working as it should is so important.
Yes, I'm so glad that you talked about that and shared that bit of your story. And, for you having done that work years prior to when you were wanting to get pregnant, and there's so many women out there who are just starting their journey or are in the midst of that journey. And the issue is that standard medical care doesn't address that health piece, which sounds so crazy to say.
Yeah.
But the treatment for PCOS fertility is just a medication, right? It's either letrozole or Clomid, and a doctor will give up to 5 rounds. If those don't work, then the next step is IVF. That is the PCOS algorithm. There's no health in there. There's no investigation of the quality of the egg. There's no prepping the soil of the body to make sure that the soil is rich and is full of the right nutrients that sets up for a healthy pregnancy, right? It's just here's a medication. This is the only tool we have. And this isn't to say that medications are bad, because they help plenty of families, and that's great. But when they don't work, which is happening so often, that's when we've got to take that step to be like, all right, this soil is not ready for this medication. We've got to prime the soil, first figure out what's deficient in the soil, why it's not ready to bloom, to make that baby, and, get that soil ready. And then at some point, usually what I see is that women are getting pregnant naturally. But if a medication is needed, imagine how different that would be when that soil is all set up for a healthy pregnancy. Like, we just need to apply that medication. Okay, there.
That makes so much sense. Yeah. I want to go back because there's so many different routes. So many different questions come to my mind. But the first thing is, I do want to go back. We were talking about the different kinds. Are you able to outline those 4 different kinds that you said? And this might be a loaded question, but you said how so you get the diagnosis of PCOS based on those 3 pillars, and then you investigate on what kind you have. And I'm assuming from there, you kind of get a more personalized protocol as to how to go about making your body healthy again. So are you able to outline those four and maybe the different protocol that comes with them?
Yeah. So, okay, let's first start with the
I know
four
that's a loaded
types.
question.
Okay, so, okay, they're just, in no particular order.
Sure.
I'll start with the first one of being insulin resistance. That's probably what people are most familiar with because PCOS is often just clumped into this idea of, okay, you have blood sugar issues, you hold on to extra weight on your body, that kind of thing, which is not true. And insulin resistant PCOS is just one type. So it happens to be very common for people with PCOS, but not everyone with PCOS has insulin resistance. So insulin resistance, of course, we're looking at blood sugar levels. We can look directly at insulin. We can look at blood glucose levels. There's a variety of ways to look at blood sugar and how it's impacting the body and creating that cascade. This is the hallmark for all four of the PCOS types is that we have to pinpoint the driver of what's creating that cascade, keeping someone from getting pregnant. Because insulin resistance, you're like, but that has to do with blood sugar and what I eat during the day. That doesn't have to do with my ovaries. Well, actually, that is the key, is looking at the body in that holistic way. We've got to talk about insulin and blood sugar and what you're eating during the day, because if insulin is spiking, well, then that's shutting down progesterone and keeping inflammation high. That's keeping your body from being able to implant a healthy pregnancy. So that's why it's so important. Okay, so that's one type is insulin resistance.
Yeah.
Another type is adrenal PCOS, and that's stress driven. So the adrenal glands are tiny glands in the body that put out our stress hormone cortisol. And when that system, from a variety of reasons, our stress-filled modern lifestyle is probably one of the top reasons that would cause the body to not put out our stress hormone cortisol in the proper rhythm, because cortisol has a rhythm throughout the day. It's the hormone that wakes us up in the morning. Cortisol does get a bad rap, but it's a very important hormone for the body when it's acting as it's supposed to. So it's high in the mornings, it wakes us up, and then it has this slow and steady fall during the day, kind of a little blip in the afternoon, and then falls. And it needs to fall pretty drastically in the evenings so then melatonin can rise. Melatonin is our sleep hormone, but it actually has a lot of research behind it as an antioxidant to help drive egg quality. So if somebody has stress cortisol levels that are high in the evenings and not dropping down to normal levels, then if they're high, that melatonin can't rise. So then of course that person is going to be experiencing things like insomnia, not being able to fall asleep that easily. But then also they have less melatonin to contribute to supporting their egg quality. Okay, so that's adrenal PCOS. Okay. And then there's inflammatory PCOS. And inflammation in the body is a generalized term. So as a clinician, it's my job to investigate, to figure out, one, is inflammation a driver of this person's PCOS fertility struggles? And two, where is it coming from? Now, the top places where inflammation comes from in the body that I see are gut issues. So, if someone's not digesting very well, has gas, bloating, diarrhea, constipation, anything like that. And those kinds of symptoms, for, whatever reason, a lot of people tend to think, well, I have that, but that's just normal. When in reality, no, that's actually a red flag saying, hey, there's inflammation here. And we've got to address this, particularly if you're struggling to get pregnant. So the digestive system, the thyroid is another top place that I find inflammation coming from, and that's through the elevated antibodies. So Hashimoto's thyroiditis is probably the top co-issue that I see with PCOS. So that's when thyroid antibodies are high. Someone can have a normal TSH level and still have elevated antibodies. And that is, I mean, we're not really getting into labs here, but I'm just going to go down this rabbit hole for a second.
Yeah, let's do it.
So TSH, the main thyroid hormone, is typically, you know, I'd say almost 95% of the time, a doctor is just ordering the TSH level to evaluate thyroid health. And when that falls into their normal reference range, they're like, all right, let's tick the box of thyroid, and, you know, your thyroid's all good. Gosh, still don't know what's going on for you. And in reality, that person's TSH could be totally fine. Their thyroid antibodies could be through the roof.
Why is that? Can you talk about that for a second? Like, is the antibodies just rising in order to make the TSH level normal? Like, it's like it's working overdrive? Is that what you're saying? Or how does that?
Yeah, no, it's a very good question. So the hallmark of Hashimoto's is a TSH that rises and falls pretty quickly, because the antibodies are creating this static in the hormonal messaging, the brain to the thyroid to the body. It's just creating this static. So the TSH is getting weird messaging signals from the brain and from the body, because TSH is the main thyroid hormone. I'm pointing to my neck if you're watching this, because that's what the thyroid is. But we have a variety of other hormones with the thyroid. There's T4, there's T3, and we've got to understand all of those messaging signals.
A lot of doctors will just check TSH and all is well. Okay, we still don't know what's wrong, but you're saying that what we should be checking for is TSH, but also the antibodies to make sure that those aren't sky high, right?
Yes. Also the other thyroid hormones, but also the antibodies. And the antibodies, what they're doing is just creating that static. So the TSH doesn't really know how to be in normal rhythm. So sometimes it's working in really high mode, and sometimes it's working really low because the messaging is off because of the inflammation of the antibodies. The thing about inflammation is that if, say, you have elevated thyroid antibodies or you have some inflammation in the digestive system, it's not localized to that area, okay? And that's the number one key here, is because, again, you know, we're talking about the thyroid, but to the person listening who's like, but doc, like, I want my ovaries to be working better, right? Well, the TSH talks to the ovaries. And so if you're working with a doctor who's completely missing the picture of your thyroid, then you're not getting that soil prepped. You're not getting the right nutrients because the TSH is not working as it's supposed to. But talking about inflammation, you know, if inflammation is in the thyroid or the digestive system, again, it's not localized to those areas. If you think of your immune system like little soldiers in your body that are protecting you. So they're at your, you know, all the openings to your body has a really high area of these immune cell soldiers, and they're walking around kind of just clearing the space, making sure nothing foreign gets in, okay? Sometimes foreign things pass through, and that's when we get colds and flus. You and I were talking earlier about our families have got like the
It is winter. It just, yes.
Yeah. And so when that inflammation is coming from the digestive system or the thyroid, that's creating this whole cascade where the inflammatory soldiers in the body are walking around like, oh my gosh, there's a red alert. We've got to, like, we need to make more of us and create more of us because there's danger in the body. And so it will create more immune cells, and then when something foreign tries to get in the body, it will knock it out. Like that can lead to sperm issues, right? The body rejecting sperm. If the egg does get implanted or connects with the sperm and then implants in the uterus, the body, because the immune signals are all off, it can then just reject that egg because it's on, the body's on high alert. It's in biologic winter, going danger, danger. We've got to move things out of the body because we don't want anything new here. And so when I'm, again, working with that patient in front of me and they have elevated thyroid antibodies, that's number one to get those down. I'll share a story to help, understand this, is that someone was working with me. She had been trying to get pregnant for over 10 years before starting to work with me. Was told the classic dismissive things about her PCOS beforehand. And she was like, gosh, there's got to be something else. So she found me, started working with me, and right away I found those thyroid antibodies were elevated. And there was a little bit of some gut inflammation going on as well. So address those things. She had never had a regular cycle. Within that first 30 days, she was having her first cycle. And then for the next 4 months moving forward, her cycle was 30 days. And it was month 4 that she was pregnant naturally.
Wow.
After so many years of trying, and no doctor had ever found that her thyroid antibodies were elevated. No doctor had talked to her about her gut health. So this is the importance. This is why this is a key clinical intervention if you want to get pregnant.
Yeah. Can I ask a question really quick too? Just out of curiosity, maybe you know the answer, maybe you don't, but why is it that checking, for this example, like checking thyroid antibodies, why isn't that a main marker that a regular mainstream doctor would do? Like, is that a difficult thing to test, or is it not really? Like, why is that? Why isn't it checked regularly?
That is an excellent question that I would love to know the answer to as well.
Right.
Yeah, I'm not sure, I think there's just some clinical misinformation out there. A lot of doctors, this is not to put any other doctor down because they're all showing up there to help their patients and their clients. But, there's a lot of doctors who are just in that they're overstretched and they're under-resourced, right? They're seeing people for 10 minutes and they're seeing 15 to 20 patients a day and things get missed. There's some misinformation about thyroid health. The American Thyroid Association has these recommendations for the robust testing, but in some fertility information that gets missed. So there's just a lot of wires that are crossed and multiple reasons, but that's why I want to talk about it, because this is such an important missing piece, particularly for the listener who is thinking, oh my gosh, like I feel like I've tried everything and my doctor is telling me that my labs are normal, so what, I must be broken. But no, it's just that missing link hasn't been figured out yet.
Yeah, absolutely. Okay, so so the first 3 you just outlined were recapping, right? We have insulin resistance, then the adrenal one with stress, and then we just talked about the inflammation. So what is the fourth kind of PCOS that you see? And
the fourth kind is post-pill. So, or more specifically, post-hormonal birth control.
Okay.
Yeah. So
talk about that.
So I see this in a couple of ways. So, one is that somebody who knows that they have PCOS and then gets on typically the pill, but maybe a form of hormonal birth control. I'm just going to say the pill for
Sure. Yeah.
just
Yeah.
ease. Gets on the pill to regulate cycles because that's the number one recommended treatment for irregular cycles with PCOS, and then gets off of it in order to try to get pregnant and is told like, oh, well, the pill regulated your cycles, so you should be ready to get pregnant once you get off it. And then once they're off it, their period doesn't even come back, and they're like, great, I can't even get a surprise pregnancy because my period isn't here. Right. So I see that picture a lot. And then I also see women who are on the pill, weren't diagnosed with PCOS beforehand, on the pill, and then once they get off of the pill, all of a sudden it's irregular or absent cycles. Acne pops up, gaining weight rapidly without making any lifestyle or diet changes. And it's just these symptoms. It's like, what's going on with my body? And the PCOS is actually presenting itself after getting off of hormonal birth control. So I see that picture. And what I see is that the hormones, those synthetic hormones in the birth control, are creating these cross connections in the sense of, because when somebody takes the pill, it's a synthetic hormone, it's a synthetic version of progesterone and estrogen that's then blocking their own brain's production of progesterone and estrogen, or the cascade that creates progesterone and estrogen. Right. So when somebody gets off of the pill, the body and the brain, they're like, wait, I can't really figure out how to get this system back in order here. And I see a lot of issues as well with cellular clearance. So if somebody has been on the pill for, a year, 2, 3, 10 years, their cellular clearance in the body is sluggish and slow, which contributes to not having the right levels of estrogen and progesterone, which contributes to the irregular cycles, or the cycle periods just not showing up anymore. And so we've got to work on cellular clearance and
can you explain what that is, cellular clearance? I've never heard that term before.
Yeah, so cellular clearance is basically the body's ability to remove toxins and metabolic waste out of cells. Yeah, and then move them out of cells, and then move them through and out of the body.
Okay, I see. So if your body is on the birth control pill, basically your cellular clearance, your body's ability to remove toxins and things like that is lowered. Is that what I'm hearing?
That's what I'm seeing.
Okay.
Yeah.
Okay.
Yeah.
Gotcha.
What I think is happening is that the pill, the synthetic hormones are just creating this sluggishness in that system for the body, which then is showing up as these symptoms once the pill or those hormones are gone. And so once we get cellular clearance back on board, moving smoothly, the women in my practice are seeing periods come back.
Yeah, which hopefully means pregnancy. Because if they're seeing periods, that hopefully means that they're ovulating, which hopefully means that they can get pregnant. Yeah. I feel like it's like, let's just get our bodies healthy, and then it can do what it's supposed to do. Like that should be, I feel like that's the goal there. Yeah.
That you summed it up so nicely.
There you go. So the women that are coming to see you, are they typically women that have already gotten the diagnosis of PCOS and they're just not getting from their mainstream doctor what they need? Or is it mostly women that are struggling with infertility for whatever reason, they come to you and you help them get the diagnosis? Or is it kind of a both and?
Yeah, I would say it's a little of both and, because some women, they're very clear in the diagnosis, they've been told, and they're in that space of, my doctor's not giving me the help I'm looking for, so please, help. And then there's this other space of women who are having symptoms classic PCOS symptoms, like, I've named a few of them, the acne, chin hair growth or back hair, having the irregular cycles, gaining weight really easily, things like that. And yet their doctor is like, no, like either won't do testing for them or just flat out says, no, you don't have PCOS. And then they're left feeling like, there's got to be more answers out there. And so I work with both of those kind of camps of women.
Yeah. So the diagnosis of PCOS, just in general, not talking about like getting deeper into the kind of subtypes, but just the diagnosis in particular, you said there were 3 pillars. Now, is that something that in mainstream medicine you'll find doctors still doing to give a proper diagnosis, or is that not even really touched in with your regular doctor?
Yeah, that's a good question. No, absolutely. So those 3 pillars of diagnosis, that's known as the Rotterdam criteria, and that's hands down like the most common form of diagnosis by any doctor. Mm-hmm.
Okay. I see. So they might get the diagnosis properly from their doctor, but then actually going about treating that, creating a healthy soil, as you were saying, to make the body just actually healthy, and managing those hormones and managing ovulation and whatnot. So when a woman is presenting herself to you, and I'm sure, sometimes I ask doctors, like, what is your typical protocol? And I know that it's so different per whatever the woman is presenting, but in general, or maybe you can give an example of a client, but when somebody comes to you, let's say they already have the diagnosis of PCOS, they've been working with their doctor, maybe struggling with infertility, what is your first step? And I'm assuming it would be, okay, let's try to figure out what kind of PCOS you have to get even deeper. But what is the typical step-by-step way that you go about helping somebody on an individualized level?
Mm-hmm. Yeah, that's a great question. And that's what I do through my PCOS fertility protocol, which I'm actually in the process of updating that into a resilience blueprint to really talk about that piece. Like, we're not just focused on fertility, we're focused on that health piece, right? And getting that soil ready. And so what I'm doing through those pathways is first, getting that clarity piece and figuring out someone's PCOS type and looking through their labs from an optimal fertility perspective, not just a survival perspective, because there is a difference. And most reference ranges for labs fall under the survival perspective. So, okay, what does a human body need? What vitamin D level does this body need for survival? Okay, great. We're not looking for survival here. We're looking for optimum. We're looking for vibrancy. We're looking for health that's ready for a whole new human to grow. So that's the brain that I have on when I'm reading fertility labs. Key part of the process there. And then helping someone improve their cellular clearance. So that's a very important early step. Again, that is getting the metabolic waste out of the cells and improving the toxins to come out of the cells and move out of the body. And I call that clearing the static, because when we can get that system working, then we say, okay, you are having all these symptoms. Once we've cleared the static of that cellular clearance and gotten that working efficiently, what's coming up from you? 9.5 times out of 10, a woman is already having a period, even if she hasn't had a period in the past year, 2, 3 years, by the time we get that cellular clearance working. Moving forward from that, I'm helping this person optimize nutrition so that it's specific to her body's needs. Again, prepping that soil, getting those nutrients in the body. And looking at egg quality, because if somebody hasn't had a period in a year or more, or is having irregular cycles, I mean, hands down, we already know that egg quality isn't optimal. And so focus on that piece, and then look at these other drivers, like gut health, and making sure that the body is in a place where it's on that path to biological safety and saying, yes, green light, we're ready for pregnancy.
Okay. So is a lot, I'm assuming, maybe if you can go into this a little bit more, but I'm assuming a lot of this is lifestyle change. You talked about earlier how, like, okay, medication isn't bad, but let's actually make a soil that's fruitful for if you need medication, it can actually have the potential to work. So how much of this for you and your clients is lifestyle change versus medication? Like, what do you see as the typical route here?
Yeah, so I'm mainly using lifestyle, diet, nutritional supplements to create this change. Sometimes medication is needed, and that's, we use that, but I rarely use medications at this point. I will say I was meeting with a new client earlier, a few days ago, and at the end of our session, she was just like, oh my gosh, like, thank you so much, because I have read so many books. I have done all this research myself, and I still feel so fuzzy brained about what direction to go. And she's like, just in this first session with you, I have this clear path forward. And I know these things about my body and what we're going to be working on moving forward. And so that is, education is a big value of mine, and really helping the person in front of me. I mean, I do all virtual sessions, so they're here on the computer with me, but helping them really understand why they aren't ovulating, why they haven't gotten pregnant yet. Because knowing that about your own body, about why things are happening, and then understanding the path forward to fix that and to make the body work as it's supposed to again. I mean, that's incredibly powerful when previously you've been in this space of just like, okay, I don't know. I go to my doctor, they just give me vague answers. So getting that clarity piece and helping that woman just walk forward confidently on the path forward.
Yeah. And I'm sure that is so a healing, obviously, because you're healing the body, but even healing in like a mindset of you've been trying and trying and trying, getting no answers. And then it's like this breath of relief. And finally, at least I have something tangible to move forward with. Like that in and of itself can be so stress relieving. Because I mean, yeah, especially when you're going through the infertility part, and it's just, maybe you are cycling, but with the PCOS, you're just cycle after cycle after cycle. There's still no two pink lines, and you're just feeling so defeated and broken, as you said. And just having a step forward, a clear path forward, I'm sure gives so many people just a little bit of stress relief in knowing that they have a little bit of control over the situation. So that's huge.
Yeah, absolutely. I talk to so many women who are telling me things like, Doc, I feel like I've tried everything, and I'm on this list of supplements, and yet I still haven't had a period in the last 75 days. And, I really acknowledge that. Like, it's hard with PCOS, and these women, they're out there doing the research and trying the supplements, but what I find is that the supplements they're just trying them, and it's kind of like throwing spaghetti at the wall to see what sticks. And if you want to get pregnant, that's not a path, a straight path forward to pregnancy, right? Just kind of seeing what sticks, hearing what other people have tried. No, you've got to know specifically what your own body needs to make those shifts. Because if you feel like you've tried everything and you've tried all these different supplements, tried diet changes, and you still haven't had a period in 75 days, then clearly what you've tried is not the missing link to get you on a bridge, to get you pregnant and where you want to be. And so that's what I work on with them. It's like, okay, yeah, you've tried all these supplements. Some of them, CoQ10, vitamin D, prenatal. Of course, there's tons of research out there on helping with fertility. But it's like, we've got to pause, get that clarity piece on what specifically your body needs, and start you on the plan for that clarity, for those drivers like the PCOS types I've been talking about, to support those systems to then help you start seeing those positive results, like getting a period, like getting a positive ovulation test.
Right.
And
Yeah.
so it's really about that specific, what's specific to your body.
Yeah. Yeah. Okay. I have another question, and this is maybe more of a niche question, but I'm also thinking about the woman who maybe she's not married, not intending on getting pregnant, like me at 18, right? I had irregular cycles. That was the beginning of me getting into this mindset of, okay, irregular cycles isn't normal. Like, that's why it's called irregular, because it's not normal. Like, it is a sign that something is wrong. So let's maybe talk about the woman who is not trying to get pregnant, whether it's because she's young or she's single, or maybe I've worked with couples, and actually me in particular as well, who they've gotten the diagnosis of PCOS. And I'm actually thinking of one client in particular who had a diagnosis of PCOS, very long cycles, but because she was charting her cycle, she was still ovulating, just not regularly. She could pinpoint when she ovulated, and she was able to still conceive. So she didn't necessarily have the infertility piece, mostly because she was charting her cycle still. But let's just talk about, for the woman who's either not struggling with infertility or not trying to get pregnant, why fix PCOS, or maybe not fix, but why get this managed? Like, what is the purpose of, because this is a lot of work, right? It's a lot of work that you're doing to make sure your body is optimal and healthy. And especially if it's not for that driving piece of wanting to get pregnant, are there any like long-term health effects that can happen for unmanaged PCOS? Like, why should somebody manage and heal their PCOS now if maybe baby is not the driving factor for them?
Mm-hmm. So there's a couple of things there. One is that when someone has PCOS and has these, again, PCOS is not specific just to the ovaries or just to progesterone and estrogen. It's creating this whole body shift in hormones, which are creating other symptoms. So for somebody who has irregular cycles and has PCOS, I mean, they could very well feel fine, and I suppose I'm not really talking to them, but so the person who is also feeling exhausted and is awake at 2 a.m. every night on her luteal phase, she has huge sugar cravings that she's like, these are out of control. Again, like the skin piece, maybe lots of acne, and she's 27. She's like, I thought I left acne behind in high school. Or losing hair is, hair loss is a common sign. And so if you're having those kinds of signs and symptoms in the body, well, then managing your PCOS is going to help you just feel more vibrant in who you are, because your body is going to be working as it's supposed to be. So then you're going to see all these other symptoms improve. Your skin's going to feel better. You're going to have more energy during the day. You're going to be able to sleep through the night. All of these things, which then impact how you show up for yourself, how you show up at work, with your partner, with your friends, which is, the foundation of life, honestly. So there's that piece, and that's going to absolutely vary depending on what sort of symptoms somebody is experiencing. Talking about longer health effects, the biggest thing is going to be that if somebody is not having a period for extended lengths of time, then that uterine lining is not being shed, and we're seeing higher rates of, or a higher risk of endometrial cancer. And so that cycle of shedding the lining of the uterus keeps the uterus in a healthy spot. And so that, I would say, is probably the number one reason for a long-term health effect, to be focusing on getting your cycles regulated now, even if you're not thinking about baby.
Yeah. Oh, that is so helpful. That is really truly what I myself am passionate about, is, helping women get that positive pregnancy test. I mean, and a baby in their arms, actually. Like, yes, we want the pregnancy test, but we want a baby in our arms, right? Like that is so important. But even setting yourself up for that when you are younger, when you are single, before you're even wanting that positive pregnancy test, that I feel like sometimes for us, it's hard to look into the future and be like, well, I'm doing this now for the sake of that, but it's not tangible. And so it can be hard to have that motivating factor. But I mean, that was my story. And I think it's also just because I have a natural passion for this and desire for good healthcare as you are providing. And so I think that was my motivating factor. But for so many women, I talk to college age students and that have irregular periods, and they're either presented with the pill and they just take it, or they're presented with the pill and they don't want that, but they have no other option. So they just kind of are like, yeah, okay, well, here I guess I just have to live with this. But in all reality, no, you don't have to just live with it. There's things you can do now. Well, Dr. Potter, do you have any last words, anything that you want our listeners to know that we haven't already discussed about PCOS before we end our time?
Well, I think what I would love the listener to walk away with from this is knowing that your body isn't broken. And yes, I mean, if you've been trying for many years to get pregnant and you still haven't seen those 2 pink lines, like, that it's been, let's honor this journey that you've been on, but it's not your fault. Your body isn't broken. There are physiological changes happening in your body that are keeping you in that biological winter. And it's all about just figuring out that missing piece to move your body towards that green light. And it is possible.
Amen to that. Well, Dr. Potter, if somebody wanted to work with you, how could they do that? Where can they find you?
Yeah, I would have them head over to my website, drangelapotter.com. I would have them go first to drangelapotter.com/resilience-roadmap. I'll send you that link.
Yeah, I'll put it in the show notes.
Yeah, because that's a 15-minute roadmap, kind of masterclass, where I really outline what to do, what to look for in your body if you have PCOS, why you haven't gotten pregnant yet, and then the clear steps forward to get you to a place where your body is ready with that green light signal. Okay. Yeah. I'll put that link in the show notes so that people can go to that. Awesome. Dr. Potter, thank you so much for your time today. I really enjoyed our conversation. Yeah, me too. Thank you so much for having me.